name's Duplant.
And I'm Jezreel Atkison.
And this is our therapeutic exercise rehab project.
So our patient is 42-year-old John Smith. He's a construction worker. One day while at work, he was walking up the stairs, twisted, felt a pop in his knee, and immediately followed by pain in his medial knee. He went to go get an MRI, which showed that he had a medial meniscus tear. He initially tried conservative rehab. However, it did not produce the results he wanted. So he chose to undergo a partial meniscectomy.
For phase 1 of our rehab plan, our goals are to relieve pain, limit swelling, reduce muscle spasm, prevent deconditioning, and protect the surgical wound. For phase 1, we wouldn't have John do any exercises because he's still in the acute phase of inflammation. But we would have him do ankle pumps to promote circulation to the area and promote healing. We would also use rest, ice, compression, and elevation to address inflammation, and use E-stim for pain. And to prevent deconditioning, we would use a UVE. And then now we'll demonstrate ankle pumps. So, sitting with your feet off the end of the table, you'll point your toes and touch your toes. Back and forth.
So for phase 2, we'll have John return to weight bearing, gradually getting off of his crutches. We'll also have him promote pain-free full range of motion. We'll want to improve his balance, start his early strengthening, as well as prevent deconditioning. For his exercises, in order to do all of those, we will have him perform heel slides, quad stretch, hamstring stretch, stationary bike. The stationary bike will help prevent deconditioning as well as maintaining range of motion. For his isometrics, we'll have him perform quad sets and hamstring sets. We'll also have him begin an aquatic program so that he can begin gait training. In order to do aquatic exercises, however, he has to have his wounds fully healed. We'll also begin his tandem stance balance, which will improve proprioception. So for heel slides, we'll have John put the towel around his foot, while seated with his back against a wall for stability. We'll have him slide his heel up to his body as far as he can, and then slowly slide it back. We'll also have him perform a hamstring stretch. We'll put the towel around his foot, bring his leg up straight, keeping his knee straight, bringing his toes towards his head. We'll also do a hamstring set, where we'll have him seated on the table, pressing his heel into the table in order to flex his hamstrings and strengthen them. He can also, while in the same position, do a quad set by pressing the back of his knee down into the table by contracting his quads. We'll also do a tandem stance balance, where he'll stand with his injured leg in the back, with his non-affected leg in the front, with his toe to his heel, and stand there as long as possible, up to 30 seconds.
So for phase 3, our main goals are to restore muscular strength and endurance, maintain the flexibility and range of motion that we previously achieved, and to gradually return to functional activities. Our exercises for phase 3, we will continue all the range of motion and stretching and the conditioning exercises that we previously stated. And then for strengthening, we would do hamstring curls, long arc quad, straight leg raises in all directions, and leg press, all to help strengthen the thigh and improve the stability of the knee. proprioception, we could progress his tandem stance balance into a single leg balance, and then start messing with the surfaces and eyes open or eyes closed. And now we'll demonstrate those. So for long arc quads, it's on the edge of the table, and just straighten it and put it in. So like that, and you can progress this exercise by adding ankle weights. And then for the straight leg raises, you lay all the way down to the table. And the directions for straight leg raises are in flexion, so here with your knees straight. And then look on the side, we'll do abduction this way. And then back extension. And then the last one, we'll offer adduction. And when you have a patient perform those, they wouldn't go through them all at once, but you would do enough of each set of each position.
So for phase 4, the aggressive phase, we will have John enhance his muscular strength and endurance by incorporating plyometrics. We will want him to maintain range of motion and flexibility gains while maintaining conditioning, and we'll begin functional and activity-specific exercises. So for his plyometrics, we'll do forward and back hops, like so. Jumping forward and backward, maintaining stability. We'll do cone jumps, setting up cones at a good length so that he's able to jump between them. Both legs. And we'll do lateral medicine ball throws to a trampoline. So we'll have him standing side with the trampoline to his side, holding a medicine ball. He'll throw the medicine ball at the trampoline, catch the medicine ball, and then throw it again and repeat. Then we'll move him to depth jumps, which is also functional for construction work, where he'll stand on a box and then he'll just jump down, maintaining stability. We'll also have him do other functional exercises such as stair climbing, box lifts, which are essentially going into a squat, lifting, keeping a straight back, and then putting it back down, all while keeping the weight in your legs, not lifting with your back. We'll also have him crawl under a table, which will simulate him maneuvering between machines and getting in tight spaces. Some activity-specific exercises for John, being a construction worker, would be lifting a toolbox, climbing up and down a ladder, and maneuvering around construction equipment.
In surgical versus non-surgical approaches to meniscal injury rehab, research shows that at 3 to 6 months, both groups that had partial meniscectomies and groups that only had conservative physical therapy were about the same as far as pain and functionality. It was slightly more statistically in favor of the group that had partial meniscectomy though, and the same study showed that 40% of the people that started in the conservative rehab protocol opted within 1 to 2 months to have a partial meniscectomy anyways. So we can gather from that they weren't getting the result that they wanted from conservative rehab, which is what our patient did anyways. Return to full activity for a partial meniscectomy is between 6 and 8 weeks, depending on the activity level of the patient, which ours is highly active. Return to full activity using the conservative treatment varies with the patient's activity as well as age, size of the tear, and compliance with the program. But it is typically reserved for patients with smaller tears that are less active, which would not make this approach beneficial for our patient.